Hey folks, Mike Lawler here. Over the last few weeks of this government shutdown, I've gotten a lot of questions from folks across the Hudson Valley. So today I'm answering a few of them directly. Let's get started. Caitlin from White Plains asks, where do you stand on moving the needle to make health insurance more affordable for your constituents and nationwide? Thanks, Caitlin. Let's start with healthcare costs, one of the largest expenses American families have to worry about besides the overall cost of living. Too many people are paying sky-high premiums and still struggling to afford health care. A lot of folks rely on premium tax credits to cover those costs. This includes the enhanced credits and the Affordable Care Act subsidies that were expanded during COVID to help with rising costs. Those ACA credits are set to expire at the end of the year because of how Democrats wrote the law 4 years ago, which is why I've signed on to bipartisan legislation to extend them for 1 year to make sure no one loses coverage or experiences a premium spike, while we work towards a longer-term fix. The bigger issue to tackle is what's driving costs. Insurance companies raising premiums year after year for our families. I'm working with both parties to hold them accountable and push for lower costs. I've introduced legislation focused on expanding access to care, too. For instance, I introduced a tax credit for IVF treatments, so starting a family isn't out of reach. And I've supported expanding coverage for fertility care, cancer screenings, and postpartum health. If you're paying for health insurance, it should actually make your care more affordable, not less. And there is more work to do, including preventing health insurance companies from owning primary care practices, or how we reform pharmacy benefit managers so that way our prescription drug prices aren't increasing, or what we can do to expand the workforce. I have a bill that would allow people who are getting educated here in the United States on a student visa to be able to stay here once they become doctors and work in our healthcare system. There's a lot we can do, but we have to be willing to work together. Which actually brings me to the next question. Margaret from Mount Vernon asks, will you back funding that supports the ACA and Medicaid so Americans stay insured? Or do you support ending the subsidies and allowing more Americans to be uninsured and at risk of preventable diseases? I've made clear that no one should lose access to health care because of political games in Washington. It's why I'm urging House leadership to act immediately after reopening the government to address the ACA premium tax credits that help working families afford coverage. Medicaid and ACA reforms must focus on long-term sustainability, better outcomes for patients, and accountability, not expanding federal control or adding to the deficit. I've worked across the aisle to protect families' access to affordable health care while pushing for real reforms to lower costs and protect coverage for those who rely on these critical programs. Howard from North Salem asks, can you explain the no tax on overtime part of the working families tax cut bill? Does it mean no taxes on hours above 40? Good question, Howard. The no tax on overtime provision means the extra half-time pay you earn for working beyond 40 hours, that premium portion, wouldn't be taxed at the federal level. You still pay taxes on your regular pay and straight time, overtime, but the bonus part would be tax-free. The goal is to reward hard work and help families keep more of what they earn. Charles from Yorktown Heights says, quote, my Democratic friends are asking why I support your work in Congress when they're hearing about cuts to SNAP and Meals on Wheels. What's the truth? It's a great question, and there's been a lot of misinformation. So here's the gist. No one is losing their benefits or seeing them cut because of H.R. 1. The reforms put in place strengthen accountability, reduce waste, and ensure that food is not taken off anyone's table. Right now, the federal government pays about 50% of the administrative costs. Under the new structure, states will pay about 75%. Moving forward, though, the federal government, which has always picked up the overall cost of SNAP, will ask the states to pick up 5% of the cost and work to reduce their error rates. States that don't manage their SNAP programs well will pay slightly more towards the overall cost of SNAP. New York, unfortunately, has one of the highest error rates in the country. so the state needs to work to improve oversight. We're also enhancing work requirements for able-bodied adults without dependent children to help more people get back to work. And we're locking in the Thrifty Food Plan until 2028, so benefits stay stable and predictable. Bottom line, we're not cutting food assistance with H.R. 1. We're making sure it's sustainable, accountable, and focused on those who truly need it. And right now, it's precisely why it's so critical to open the government back up to make sure that working families who rely on SNAP and WIC do not see any interruptions to their benefits. Naomi from Briarcliff Manor asks, like so many parents, I'm scared of sending my kids to school. What are you doing to keep schools safe? Naomi, I hear you. As a parent myself, I understand that fear. That's why I helped introduce the SWAT Act, which improves coordination between schools and law enforcement so they can respond quickly in emergencies. School swatting is not a prank. It's a dangerous crime that terrorizes families, disrupts classrooms, and puts students, teachers, and law enforcement in harm's way. I'm also working with Congressman Josh Gottheimer, a Democrat from New Jersey, on the Strengthening Our Schools SOS Act to increase funding for school resource officers and strengthen security infrastructure. And then when it comes to preventing violence, I support common sense gun safety, background checks, red flag laws, and keeping undetectable firearms out of our schools. It's why I was proud to pass the Undetectable Firearms Act last Congress and get that extended for 7 years. I've also introduced a tax credit for safe storage of firearms because protecting kids starts with responsibility at home. Now, thanks again to everyone who submitted a question. If I didn't get to yours, don't worry, keep them coming. You can submit a question anytime at the link below, and we'll continue doing these updates regularly. I'll see you next time on Lawler Listens. As always, my job is to listen, speak up, and get results for the Hudson Valley.